RN when it comes to the NCLEX exam. So like, how exactly do they differentiate as far as what are the roles and responsibilities that the NCLEX expects you to understand? Not necessarily what it may be in reality, but what it is for the sake of the NCLEX. That is what we're going to be talking about in today's video. Hey, so before we move on, one thing I want to mention is that, it's really important to be able to stay awake, stay alert, right? And sometimes you want to do that without the crash and the burn that comes with like coffee and other things. So I want to recommend to you our energy shots here. These are all totally natural ingredients, okay? And it also contains like B6, B12. It does have caffeine in it, so it's gonna wake you right up, and it comes in both grape as well as orange. So these are our energy shots. Just click the link below this video and use the code that's included below the video, and you'll be able to get it at a special deal. You'll get a full pack, and this really lasts honestly for like a long time, and it tastes excellent. So what I want to go over with you is just helping you to kind of break down what is the difference between the two, and like what you need to know when it comes to NCLEX questions, especially priority questions, delegation questions, that type of stuff. So first, let's talk about the LPN, all right? So LPN, which stands for Licensed Practical Nurse, or LVN, which stands for Licensed Vocational Nurse. So what the LPN can do based on the NCLEX exam is that the LPN can only give medications that are either oral, topical, sublingual, or subcutaneous. All right, one more time: oral, topical, sublingual, or subcutaneous. So no medications that need to be administered through the IV. All right, so no intravenous pushes and no intravenous piggyback medications. So so that's the aspect as far as medication administration. The other thing though is also as far as like roles and responsibilities. So for the LPN cannot do any type of like planning, or as far as like creating a care plan. That's supposed to be delegated to the RN. So no planning as far as creating a care plan. And then the LPN can only reinforce education, not teach new education. So if it's something that the patient was already exposed to, already learned, and let's say it's discharge time and the patient has been learning this throughout their hospitalization, then the LPN can reinforce. So what you have to consider when you're looking at NCLEX questions is what are the needs that we need to anticipate based on what the question is telling you. And then that will help you determine if this is appropriate for the LPN or if it should go to an RN. So for example, if you have a patient, let's say the question says that you have a patient that is expected to have surgery today, and they're gonna have the surgery today, would you delegate that to the LPN or to the RN? Well, think about that. If they're gonna come back from surgery, they're likely gonna, and it's some type of invasive surgery, more than likely, then it's gonna require a new sense of assessment. So that means they have to be assessed, a new assessment. So that's another thing as well, is that LPNs are technically not supposed to assess when it comes to the NCLEX. So that's gonna require a new assessment. In addition to that, if they're coming back from surgery, they're gonna need fluids, right? So they're gonna need to be on maintenance fluids. So, and maintenance fluids is given through an IV, right? In addition to that, if they're going to be coming back from surgery, they're probably gonna need pain medication, right? So they're gonna need to be on pain meds, they're gonna probably need some IV anti-nausea meds, and all that is typically gonna be given via the IV because they just had surgery. So what you have to consider when you're looking at questions that have to do with prioritization and delegation is, first you have to understand and know by heart all of the things that are appropriate for the LPN, which I just said, and then you have to understand, okay, based on that, does this question, are we going to be anticipating that they're going to need any of the needs that the LPN cannot do. And that will help you to pick the most appropriate answer. So a lot of times when people pick the wrong choice, is either they're not totally clear on what the LPN can or cannot do for the sake of the NCLEX, and or they're not anticipating the needs of the patient. They're only thinking about what the question is saying right now, not necessarily what they're going to need. And so what a nurse does that shows competency to pass the test is that you can anticipate the needs of your patient. All right, now moving on to the RN, right? The role of the RN. So with the RN, right, the RN can do all those things plus more. So the RN can give all the type of medications, right? So they can give oral, sublingual, topical, IV push, IV piggyback. So every route is available to the registered nurse to administer. In addition to that, the RN can do new assessment. All right, so new assessment. So if, let's say, they have a new issue or a new diagnosis, or we can anticipate a new problem, or they need to have a new assessment, then that's going to be for the RN, right? Another thing as well is that the RN can create care plans. So if you have a question that has to do with planning, care plans, then that's appropriate for the RN, right? So these are all the type of things. Also, typically RNs will do admissions, but LPNs cannot, right? So this is also common as well in the workplace too. So for the sake of the NCLEX, RNs can do admissions, but LPNs cannot. It depends on the facility as well, right? When we're looking at protocols and state requirements and etc. But for the sake of the NCLEX, typically they can't do admissions. All right, but the RN can do admissions. All right, so RNs can do admissions, new assessment, new planning. They can give all the types of routes of the medications, and then they can delegate, obviously. So they can delegate to the LPN, delegate to the CNA, right? And then LPNs can obviously communicate with the doctor, and RNs can obviously also communicate with the doctor. And then RNs can provide new teaching or new education. So RNs can teach and educate brand new information. All right. So typically, this is what you're thinking about, is that with the RNs, they can provide new education and new teaching. All right. So when you look at NCLEX, when you look at questions too, and especially when you get questions now where it's asking you more so as far as like, let's say it's already anticipated that you're gonna have RN. But the question is, okay, the specialty, right? Or are they a new grad nurse, right? So then that gets a little bit different, right? So you really have to look at the context of the question. But when we're talking about LPN versus RN, this is essentially the main differences between the two as far as what the LPN can do, and then also what the RN can do. All right, so I hope that you found this information beneficial and that you learned a couple of things. And what I would love for you to do is comment below, and if you want to even scribe some of the things I said, comment below. Tell me one thing that you took away from or that you learned as far as the LPN versus the RN. And then when it comes, like I said, when it comes to questions and delegation, this is the things that you need to be thinking about when you're answering priority questions and delegation questions. You have to have it very, very clear so you do not confuse the two. All right, thank you so much for watching. And then once again, if you haven't already, make sure that you download my free guide. I have a free guide that will help you to pass your NCLEX exam. You can learn more about it below this video. And then you can also definitely sign up for our courses, right? So we have different types of courses that will teach you how to pass your RN exam or pass your LPN exam. So whether you are a repeat test taker or whether you're a first-time test taker, it's definitely going to benefit you. We are primarily known to really help repeat test takers that's been struggling, and that we've had such phenomenal testimonials of people that have struggled for years to pass their exam, and then they finally passed using our help. So go ahead and check out the link below or above this video so you can take advantage of our courses today. All right, thank you for watching. Hit the subscribe button, like the video, all right, check out more, and I'll see you the next time.